What's up, runners? Why you don't have to quit running if you have knee pain. Look, again, if you're a runner dealing with knee pain, you've probably been told by a doctor sometime, if it hurts, don't do it. Sounds logical, right? Except it can be terrible advice. I'm about to tell you why quitting running might actually make things worse and what you should do instead. So, knee pain is common, but it's not a death sentence for running. See, 25% of runners experience knee pain. And although there are some knee pain that you could just take some temporary rest, I'm not saying doctors are that advice of if it hurts, don't do it is completely wrong. For example, if you just sprained your ankle or just sprained your knee, taking a week or two of rest will often resolve like a mild sprain. But however, there's other cases of knee pain that will persist, and just bed rest alone is not going to cut it. Further, you may have gone to a doctor, you might have gone to a urgent care place, whatever, got an MRI of your knee, and then maybe shown like, oh, it maybe has degenerative changes. Maybe you're an older runner, it shows like knee arthritis, or maybe it shows meniscus tear. But MRIs are not always accurate. About 70%, 76% of older folks with no knee pain show changes in their MRI, like degenerative changes in MRI. Because the truth about degenerative changes, they're just normal age-related changes, like wrinkles in the skin, the tissues, even the joints itself will start to have some normal age-related wear and tear. It doesn't mean it's always the cause of pain. And then with like meniscus tears and different changes in the knee, there's actually studies done on basketball players where 35% of college basketball players also had abnormal changes on their knee MRI, yet had no pain. So you can't always just rely on the MRI to tell you what's wrong. Another thing about the knee, and when you're thinking about MRI, there's even other studies that show that many experts disagree on the findings in the MRI. For example, you could go to two different radiologists to get a reading, and you'll have different interpretations of the results. So it's oftentimes they could be misleading. And surgeons also sometimes disagree with what the findings in the MRI. So an MRI may show something, but when they go in to actually do the surgery, they find there's other things that the MRI didn't actually capture when they actually go in to do their surgery or investigate. So, and before you do surgery, make sure you get a second opinion, because one out of three knee replacement surgeries are completely unnecessary. You could have avoided them altogether. And I understand this may be confusing. You're like, the doctor's the expert. It's the knee guy in town, the knee gal, the resident knee doctor who's in your town who's supposed to be the best knee doctor there is. However, always get a second opinion before you jump to knee surgery. So the bottom line, pain doesn't always equal harm, and pain doesn't always equal permanent tissue damage. In most cases, you can actually rehab your knee. So why, if it hurts, don't do it, is misleading. So again, doctors again will often default to the safest answer, stop running. And then you also may get confused because then you probably check out influencers, maybe physical therapists or strength coaches who say no pain, no gain. However, which is it? Neither. You need the right approach. There's like a middle ground here. While when you're doing rehab, there is some pain that you might experience. If we use like a 0 to 10 scale, you might feel like a 4 out of 5 discomfort, but it shouldn't be worse. Like, let's take the knee again. So if you're doing a knee exercise, let's say it's a long arc quadricep, so you seated knee extensions where you're sitting at the edge of the bed and maybe you have like a resistance band or a light weight, you may feel some discomfort as you're loading up the knee joint. But that doesn't mean that you have to avoid all the discomfort altogether. It doesn't mean you're damaging the joint or that's a dangerous exercise per se. Now, if the pain is severe, you may just have to modify it. And the same thing goes with running. Like you may be feeling pain with running. Doesn't mean you have to stop running altogether, all completely. It just means you may have to modify it. And in some cases, you may have to taper down to just a walk or walk-run protocol. So like a common run-walk protocol when you're like dealing with pain will be like run 10 seconds, walk for 50 seconds. But if you can't even handle 10 seconds of running, then yes, you'll have to like drop it down to walking, or consider cross training with like cycling or elliptical, or even doing aqua jogging, where you do running in a deep end of a pool, either running on an underwater treadmill or running with like an aqua jogging vest. So let's also go a little bit into why most knee pain is fixable. 42% of knee pain is mechanical in nature, meaning you could change how you move and fix it. It has a clear behavior of how it behaves. Like you understand, hey, what makes it worse? You maybe see a pattern like, hey, if you sit too long with your knee bent, it tends to get worse. Or if you climb down a bunch of stairs, like climbing downstairs tends to aggravate it, or downhill running tends to aggravate it. Like it has a very clear pattern. You can localize the pain to the knee joint. You're like, okay, it has a clear pattern of behavior, and you just have to know the right type of load or loading exercises to improve your knee. Now, low doesn't always just mean strength. So a lot of times people will hear this, for trainers will think, oh, it just means I have to do strength training. Now, strength matters. Don't get me wrong, I love strength training, but there's other factors in key when you're rehabbing an injury like knee pain. It could be an issue with mobility. It could be knee joint mobility, right? And to improve knee joint mobility is different than just doing strength training. Or it could be a motor control issue, which is actually how you activate the muscles. For example, motor control could be that your glutes not activating enough, like your glutes have poor activation and your hamstrings are overpowering your glutes. And it doesn't mean you just have to do more strength training for your glutes. It's actually a timing thing of how you sequence the muscle activation, something called motor control. That some physical therapists know about this concept, but a lot of personal trainers don't. And then they may just blindly tell you, oh, do squats and knee extensions or leg presses, but not really aware of motor control strategies to activate the right muscles in the right sequence of activation. Or they might not, also, maybe people not aware that, hey, knee pain could just be an issue with knee joint mobility. Maybe a common thing I see is that they're just lacking knee extension range of motion. So I have to work on making sure the knee is able to fully straighten, or in some cases even hyperextend, just so their knee is somewhat symmetrical from side to side, because they may have one knee that's stiffer, the other knee has normal motion. Then I need to make sure their knees have like symmetrical range of motion and both the extension and flexion range of motion, so they could be able to run and tolerate running without putting too much stress on the knee joint. Or other times, the knee pain may actually be coming upstream. It may be due to an issue with tight hips or even the lower back. Actually, the spine can be a source of knee pain symptoms. In about 25% of cases, actually, the lumbar spine is, and I'm not just talking about sciatica, which is like pain down the leg. There's actually cases where it's just isolated knee pain, but it's actually coming from the low back. And this might be confusing. Like, what? How does that happen? And that's where I'll talk about that a little bit later. Like, how do you properly find out what's the root cause of this pain? And this is a type of specialized training that physical therapists and other types of providers who've taken like advanced courses know how to handle when dealing with mechanical type of pain. So, what's the right rehab for people with knee pain? Right? So, how can you run without knee pain? So as a general guideline, again, it's going to vary case by case basis. I would have to do an assessment on you one-to-one to really determine what you need exactly. But as a general basis, you just have to do progressive loading. Yes, strengthening is important in a gradual progressive way, but also modifying the activities. It's not about just quitting running altogether. Like, 'cause I've seen that a lot of times too, where a lot of runners are like, oh, I'm just going to take 6 months off, and then I'm going to go back to running. And then they're shocked when the knee pain comes back, because it wasn't just about rest, right? Many times it's about loading the tissue the right way, whether it's loading up the muscles that support the knee, whether it's loading up the joint itself with different joint mobility exercises, or whether it's going upstream, like loading up the hip muscles or the hip joint, or even the lower back with the right exercises to help get rid of the knee pain. And that's where the mechanical assessment comes in play. And then when we talk about running, it may be something as simple as, hey, if notice that, hills always kills your knees. Like for me, when I used to deal with knee pain, that when I do, hill workouts, those hill repeats, that hills would destroy my knees, would have to just temporarily take a break from hill workouts and just do flat runs temporarily until I could rehab my knee. Or maybe you need to switch from the surface you're running on, from pavement to trails or running on a treadmill. The trail tends to be gentler on the joints. Or you may just have to do, like I spoke about earlier, doing the run-walk intervals. And then you might have to go just completely low impact, which is, again, the aqua jogging. You're in the swimming pool, and you can still mimic the movements of running, but then you're having like no impact through the joints with the aqua jogging. And if you don't have access to a swimming pool, elliptical is also fairly similar to the pattern that you do in running, with the legs, alternating leg movement, and the arm swing. So who actually succeeds at fixing knee pain? So even though you may actually find a provider like a physical therapist like myself who understands mechanical knee pain and how to work with mechanical knee pain, there's still individual factors that determine who actually succeeds. So I've borrowed this concept from other trainers in the field of like behavioral and motivation. So the first type of people who actually succeed in rehabbing their injury, their knee injury, are people who I would consider masters of the sport. They really want to master their body. They're long-term thinkers. They're willing to put in the work. They're willing to commit to the process of actually getting better. They don't just give up at like, oh, day one, it didn't work. That means I'm going to quit altogether. No, they understand, hey, that the troubleshoot, or maybe they tried physical therapy in the past, but they're open-minded, like, hey, there's probably a solution out there. I don't have to jump to surgery right away. They're masters of their craft. They really want to get back to running there. Maybe they're passionate about it. Or they're just passionate about their health and fitness in general, and know that you don't always have to jump to medications, injections, or surgery to get better. And then we got a second type of people. I call them stressors. Maybe they run for stress relief. Maybe they work a full-time job. Maybe they're type A personalities, but then they tend to get burned out. I mean, they're willing to work hard to an extent, but then if they see it's not working, they start stressing out, they start freaking out, they quit. And they want to jump right, like, okay, this didn't work. I tried it for a month, maybe I tried it for 2 months, but now I want to do surgery. And these are people who I call stressors. They just kind of stress out. And unfortunately, they may do the surgery, and sure, I pray that the surgery works for them, but in other cases, the surgery doesn't work for them, and they're still frustrated because now they did the surgery and they feel like the surgery failed them, and now they're thinking of doing another surgery, and they keep jumping from different doctors and providers, and they're just in this cycle of pain and burnout, and they're just frustrated, right? And when it really just was, hey, if you found the right type of provider and you didn't jump to surgery right away, because surgery has its own complications, right? You might develop scar tissue with the scar tissue on top of the original injury. So now you're having this knee pain that just got worsened when you thought the knee surgery was supposed to help you. And then the third type of person is the dabbler, right? Maybe they try rehab and they quit too soon. Their knee pain returns right away. This is the person who they run, but it's seasonal. They're not that passionate about the sport of running. They did it because it was on a whim. Maybe their friend was doing a race. They thought it would be a good idea to do their first marathon, but they don't care too much about it. It's like a bucket list thing, but they could wait till later. They tend to maybe dabble in the sport of running, and then it carries over to the rehab. They will dabble into their rehab. They may just do a few weeks, and then they're like, okay, this is not working. They just give up, and they stop showing up. And they quit too soon. And then they think, okay, this is the type of folk who will just, I'll wait a year or 6 months or whatever, and they'll come back, and the pain comes back. Oh, no, the pain is still there. Maybe they think it's just their genetics. They just have to live with the pain. But that's not true. The thing is, they just weren't doing the right method, and they were just committing to the process. Because most types of rehab, if you commit to it and you're consistent, you either find that if it doesn't work or not in a month, that's fine, but you can oftentimes switch providers, find someone who actually understands mechanical knee pain and how to work with runners. Because I understand you may want to use your insurance, but you may be in your neighborhood or where you're at. You may just work with a generalist, someone who doesn't work with runners, and they're like, oh, it didn't get better. It's probably because you just weren't working with someone who really understands runners, but it also understands this thing of mechanical pain. And that's why it comes to my next point here, which is work with the right specialist. So not just any random physical therapist, find one trained in mechanical diagnosis and therapy, something called the McKenzie method. That's something I'm actually specialized in. I have a diploma in the mechanical diagnosis and therapy. And a good physical therapist trained in MDT and that McKenzie method will pinpoint the root cause of the pain, give you effective rehab, not just generic exercises, and teach you how to self-treat so it doesn't come back. So they teach you how to prevent future reoccurrences. And they're really effective at doing this. I've been doing this since the pandemic, since 2020, online. And then prior to that, I've obviously worked in person as a physical therapist and trained in the McKenzie, the mechanical diagnosis and therapy in person. So I've been doing this almost 10 years now, but online, purely online with some of my run clients here for the pandemic, we're like 5 years now. And it is definitely possible to rehab with the right exercise, because the right exercise matters. You just can't go, oh, I'm just going to look up online, random influencer or trainer or physical therapist said, oh, do squats or step downs, right? Oh, I found this knee exercise. And then like, oh, it doesn't work, because the right exercise matters, right? We have to, again, determine, is it a joint problem, an issue with the joint mobility? Is it a strength problem? Is it an issue with the muscles? And then where? Is it at the knee joint? Is that the knee the source of the pain? Is it coming from the hip? Is it coming from the back? So the right exercise matters. And then working with a mechanically trained therapist, again, someone trained in MDT, like myself, can actually determine, hey, what's the root cause of the pain? And how can we rehab it in the most time-efficient manner? If I've had success with this method, rehabbing most cases of like knee pain, runner's knee pain, in just 2 months. People are like, whoa, how do you do that in just 2 months when maybe you've tried physical therapy, you've been there for 4 or 5, 6 months, or even a year or longer, you thought that PT just failed you? It's just because, again, there's different types of PT, and there's different types of specialties. And the one I specialize in is this MDT. It's very effective. Now, yes, there are some cases that do take longer to rehab, like sometimes types of knee pain that are caused by something called true chronic pain syndrome, or chronic pain syndrome is like sensitivity of the nervous system. That's like a topic for another story, but that type of pain does take much longer time to rehab. But that's also a very smaller subset of the population of people with knee pain. So I would say maybe like 10 or 20% of people really have this true chronic pain syndrome. And then there's people who have like just a true like ligament, like an ACL rupture tear. And in those cases, yes, surgery can be indicated. You had an ACL, rupture that needs to be reconstructed. That's a different story. And, ACL rehab can take a full year or more. And that's a different case. But I'm talking about just the run-of-the-mill mechanical knee pain, something like patellofemoral pain syndrome, even IT band syndrome. Those things can be rehabbed with the right type of exercises, and then working with the right type of provider can really help speed along the process. So if you love running and don't want to let knee pain to like hold you back, there is a way forward. So find a solid PT or a rehab specialist who is trained in this MDT method of mechanical diagnosis and therapy, commit to the process, and start making progress. And if you found this helpful, hit that like button, subscribe, let me know in the comments. And if you want to learn more, join my free course for runners on running pain-free, and I'll drop that link in the show notes.